Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and today we will talk about subfertility. We divided this lecture into 5 sections. In the first section we will cover introduction, in which we will talk about definition of subfertility, what's natural conception and what are different factors affect the natural conception. In the second section, we will talk about some of the common causes of the subfertility, and the causes are further divided into male factors and female factors leading to subfertility. And then we will also talk about very important topic, what to ask the patients with subfertility when you take the history of the patients. In the third section, we will talk about different investigations to diagnose the subfertility in the males, in the females, and then also very important investigation done, which is the measurement of the ovarian reserve, that gives the idea that how good will be the prognosis of the patients if they go for intrauterine insemination or in vitro fertilization. So, measurement of the ovarian reserve. In the fourth section, we will talk about the treatment of subfertility, which the important treatment options are ovulation, induction, then laparoscopy to find out different causes of subfertility, and then IUI, intrauterine insemination, in which the sperms are directly introduced into the uterus to increase the chances of fertilization of the ovum. And in the last, we will talk about different steps involved in vitro fertilization. And then what's the definition of in vitro? What are the different steps and complications of in vitro fertilization? So we will talk about all these topics in detail in different sections of this lecture. So this concludes all the outline of the lecture topic, subfertility. So hopefully you are more interested, more willing to learn about this topic. So keep watching sqadia.com to learn more about the subfertility.